Hi, my name is Jonathan. I will be the pharmacist discussing your test results today. So let's get started. So it looks like we'll start with your blood pressure. It was 136 over 86. That is still considered stage 1 hypertension. You have a history of hypertension, and you are currently on medications for it. Going to your blood glucose, that's just your what's commonly known as your blood sugar, just how much glucose is in your blood at a time. So it's just saying that there's 120 milligrams per deciliter in right now as you are fasting. That is in the range of prediabetes. So that's something that we need to watch out for. We'll go next to your cholesterols. So your total cholesterol is 190 milligrams per deciliter. This is all of the cholesterol in your body, both the good and the bad. While your triglycerides, which is all the fat that's in the blood, is 155 milligrams per deciliter. And then next is your HDL, which is your high density lipoprotein, which is the good cholesterol, as everybody refers it to, is 36 milligrams per deciliter. This is what carries the bad cholesterol, which is the LDL, out of your blood, and so that it doesn't build up plaques. While your LDL is 154 milligrams per deciliter, that is borderline high, which we need to work on. Just starting off with your HDL, which is 36 milligrams per deciliter. That's kind of low in the poor category, so this means that there's not that many good cholesterols to help combat the bad cholesterol. While your LDL is 154 milligrams per deciliter, that is borderline high and something that we need to be concerned about, but that can also be changed with diet, exercise, and making some lifestyle modifications. Your triglycerides are 155 milligrams per deciliter, so not too bad. Not the best though. We want to make sure that they are under 150, so almost there. While your total cholesterol is 190, that's normal. It's under 200. That's where we want to see it, but again, it's getting there where it can be considered a problem. Now, you did report that you did eat, your diet consisted mostly of fast food or frozen meals. That's something that we can change because frozen meals contain a lot of sodium, fats, a lot of processed food. Big thing is to change our diet, so eating more leafy greens, lean proteins, good carbs. Go if you need help with that. Going to myplate.gov, get the recommendations there. Then also, it looks like you also drink alcohol, 2 to 3 beers, three nights a week. That can cause some issues with our LDL and our LDL and cholesterol in general. So maybe cutting that down to 1 beer every week, or even less than that. As well as we want to make sure that we are exercising more. So you jog twice a week. We want to make sure that we are getting those numbers up to about 150 minutes of moderate to vigorous moderate exercise, or 75 minutes of vigorous exercise 5 days a week. I did run a quick risk assessment called the ASCVD risk, which takes a look at where your heart health is at the current moment. Right now, you're at a 13.8%, which is an intermediate risk of having a cardiovascular event such as a heart attack, stroke, a blocked artery. The optimal is 5.1%. So I would recommend, since our cholesterol is on the higher side, that we go see a provider and possibly get started on a cholesterol medication or therapy, and along with those lifestyle changes, you'll be able to bring those numbers down. Also, with that blood glucose being in that pre-diabetic stage, with these lifestyle changes, you'll be good there to hopefully bring that down and get out of that pre-diabetic stage. Because since we did have your father did have diabetes, you are more susceptible to getting diabetes. So again, if you have any questions about that, just let us know, and we're more than willing to help you.